Let's discuss managing multiple relationships in counseling practice. When we refer to multiple relationships, we're talking about having two or more simultaneous or sequential relationships with a client. So we're not just talking about having two or more relationships simultaneously, meaning that you're having these relationships while the person is your client. We're also referring to sequential relationships, which means that if at one point you were this person's therapist and then later they become your accountants, even though they're not your accountant while they're in therapy with you, that would still constitute a multiple relationship. And these multiple relationships can be professional relationships. So again, the example of having this person as your client and then later as your accountant, those will be two professional relationships. They can be personal relationships, like having, friendships with your clients, sexual or non-sexual. So all of these would constitute multiple relationships. Some multiple relationships are clearly exploitive and do harm to the client, but some are less clear, like non-sexual relationships. So let's see exactly what APA has to say about multiple relationships. A multiple relationship occurs when a psychologist is in a professional role with the person and one, at the same time, is in another role with the same person. So these are multiple roles, multiple relationships with the same person. Two, at the same time, is in a relationship with a person closely associated with or related to the person with whom the psychologist has a professional relationship. So this means having a relationship with somebody who is related to or close to your client is also a multiple relationship. So dating one of your client's friends or relatives, having your client's wife as your hairdresser, these types of relationships with people who are close to your client are also multiple relationships. Or three, promises to enter into another relationship in the future with the person or person closely associated with or related to the person. So promising to have a relationship with your client after therapy ends or having a relationship with someone who is close to your client after therapy ends would also be a multiple relationship. A psychologist refrains from entering into a multiple relationship if the multiple relationship could reasonably be expected to impair the psychologist's objectivity, competence, or effectiveness in performing his or her functions as a psychologist, or otherwise risk exploitation or harm to the person with whom the professional relationship exists. So again, it doesn't say that you, in all cases, have to refrain from multiple relationships. It says you should, if it can reasonably, so again, some gray area, reasonably be expected to impair the psychologist's ability to work with the client or cause harm to the client. Multiple relationships that would not reasonably be expected to cause impairment or risk exploitation or harm are not unethical. So this says that some multiple relationships are in fact ethical. So therapists are often called upon to play multiple roles that may result in multiple relationships. Sometimes multiple relationships just are unavoidable or are difficult to avoid. So for example, I'm a therapist, I'm also a professor. So I might teach you and you might have a friend who needs a therapist in my area and refer your friend to therapy. So that would be considered a multiple relationship. And in that case, I'd have to, discuss with the potential client if that could possibly cause them harm in some way or impair my ability to work with them. So because I'm a teacher and a therapist, people who are friends or relatives of people I teach could potentially be my clients. So we are called upon to manage multiple relationships and responsibilities in an ethical way. You must deal with the power differential that's inherent in therapy and training relationships and strive to use that power in a way that minimizes harm to clients, students, and supervisees. And so this is speaking to the fact that, when you're in a therapist-client relationship, the therapist is always in a one-up position. They always have more power. If you're in a training position where you're the professor or the supervisor, you're always in a one-up position in relation to your students or your supervisees. You always have more power. And you really have to manage this power when it comes to multiple relationships because In one setting, I might be your therapist or your supervisor or your professor, but in another setting, I may not have that same role. So you have to manage that power and not abuse that power in any situation, but definitely not when you're in a multiple relationship with that person. So how do you minimize the risk of multiple relationships? First, determine if the potential benefits outweigh the potential harm. The only reason to ever enter into this type of relationship would be there are potential benefits that outweigh the harm it could possibly cause. Set healthy boundaries early. Make sure that you all know what to expect of each other in the context of every relationship that you have. Involve the client in ongoing discussion and decision making. Again, it should always be collaborative. You shouldn't make decisions on your own. Involve the client and document your discussions. Make sure that you're documenting that you weighed these risks and benefits with the client, you've had a discussion, and you came to the agreement that this relationship is one that's unlikely to cause them harm. You should have clear expectations of each other. And as always, consult with your peers, consult with fellow professionals, and have somebody else weigh in on the situation. When the risk of harm is high, work under supervision and document. Now, if the risk of harm is high, you should at all costs avoid the relationship. But if it's unavoidable and high risk, certainly work under the supervision of someone else and document that you have sought supervision, which lets people know that you have gone out of your way to make sure that you're minimizing the harm potential to the client. Self-monitor throughout the process. Make sure that the client's needs are being met by these relationships, not your own. And when it comes down to it, avoid multiple relationships if at all possible. So one way of minimizing harm in a multiple relationship is to establish personal and professional boundaries. Now, if you have problems in your personal life setting and maintaining boundaries, you're likely to have them in your professional life as well. So that's something you need to address through your own personal counseling, through some self-exploration, and make sure that you don't have those same problems in professional settings. It's important to distinguish between boundary crossings and boundary violations. A boundary crossing is a departure from a commonly accepted practice that could potentially benefit the client. So this could be something like attending your client's wedding or attending their graduation. Now, seeing them in a social setting or seeing them outside of your professional setting would be a departure from commonly accepted practice. This could benefit the client. Their wedding or their graduation could be the culmination of some of the work that you've done together, and it could mean a lot and could benefit the client to see you there on that special day. So this would be a boundary crossing. As opposed to a boundary violation, this is a serious breach that harms the client and is unethical. So this would be something like having a personal relationship, having a friendship with the client. Certainly a sexual relationship would be a boundary violation. It's also important that you have boundaries in the area of social media. So first of all, set up distinct personal and professional pages. If you choose to use social media, make sure that your professional page is separate from your personal page, and you should only, interact with your clients through the professional page. Even with your, personal and professional pages being separate, you want to limit what is shared online. So just because it's a personal page, it's not open to the public, and you would never, accept friends, accept your clients as friends through your personal page, you still want to limit what is shared online. You want to assume that your clients and your colleagues will see what's on your personal page, because you never know who is friends with whom and who might be sharing your page with somebody who is not following or a friend of your page. So make sure that you always think about people seeing what's on your personal page, even if it's not public. You'll want to include clear social media policies as part of your informed consent, and check and update your privacy settings. You may assume that something is private and not being seen, but you always want to check those settings to make sure that nothing has changed and keep them current.